Welcome to the Pod of Inquiry. Ready for some thought-provoking cerebral whipping and the destruction of ridiculous medical dogma? Want to shift those stale, moldy old paradigms? Well then, don that thinking cap of yours. Get down in the cave and join our host, Dr. Stephen Barrett, for this week's episode. Let's start spelunking.
My guest today is Dr. Andrew MacLean Pagon, who is a psychiatrist, but not just any psychiatrist. He's also a bona fide shaman who holds additional degrees with a doctorate in both the history of medicine and in clinical psychiatry, with a subspecialty in integrated and transcultural and transpersonal clinical psychiatry. Dr. Pagon is a very eclectic practitioner with more than 3 decades of experience in plant-based medicine dealing with psychedelic and entheogenic agents. His background is so varied, it's incredible. And an example of this is the fact that he has lived in the Amazon with indigenous tribes learning the sacred ceremonies of ancient medicine. I do not believe I've had the fortune to meet anyone who's more understanding of transcultural medicine and connectedness of the human condition with the vast universe that we live in. Please enjoy this really insightful and interesting conversation I had with Dr. Andrew MacLean Pagon. All right, I am here with Dr. MacLean Pagon. Pagon. And where are you right now? You're in Peru, right?
Yes, I'm in Peru at the moment, and within 2 weeks, I'll be heading for India for half a year to do some work in a hospital there and do some research into different medical systems in India, because it's important for people to understand there are different medical systems still in this world, and there are alternative and complementary therapies. This is not the same.
Understood.
And if one studies history of medicine, and I have been very fortunate to study that subject in detail, and I do have PhD in that subject too. It's in this world, we have a conventional orthodox medicine. Everybody knows we're conventional orthodox psychiatry. Everybody knows we're conventional orthodox psychology. Everybody knows. But in India is the only still living ancient civilization, which is still having other medical systems which are before the conventional orthodox medicine, such as Ayurveda, such as Siddha, such as Unani, which is a combination of ancient Greek and even Sina or Avicenna, Persian and Arabic medicine. Then we have a Tibetan Buddhist medicine, and we have a Tibetan shamanic medicine, and then we have a Han Chinese medicine. These are all medical systems. What does a medical system mean? They have their own theory, they have their own physiology, they have their own pathology, they have their own treatment, they have their own prognosis, and they are all valid. And my approach is integration of modern medicine, psychology, and psychiatry with different traditional medical systems, because that gives us a completely different approach. It gives us holistic, transpersonal, transcultural, and entheogenic approach, because I've been clinically working with entheogens, or what it's now called psychedelics, for the last 35 years. So I came to a conclusion, limited conclusion, of course, because the knowledge is an infinite thing. One always can learn more.
Let me ask you, let me interrupt 1 second, because I think there's some confusion, at least with some of my listeners and myself, the difference between an entheogen and a psychedelic. I understood that the entheogen is a psychedelic, but it has more of a character of empathetic. It's hard for me to explain, but are they one and the same term, or is there a little difference between the terms?
Well, Entheogen is entheogenesis from Greek, which means that which generates divine within.
Okay.
And psychedelic is psychodelos, that which manifests in the psyche. And psyche originally it was a soul, but then later it was changed to mind. So I don't particularly enjoy the term psychedelics because it's related to psychosis
So
in one way or another. And entheogen is for me a better definition, even that might not entirely include everything, although the entheogens are actually a natural substances which different groups or people through the history been using for the healing, for the spiritual reasons, or in order to grow and evolve beyond, to be in touch with that which is beyond oneself, or what some call God, or maybe universal consciousness, or great spirit, or whatever. So entheogens were more traditional way of usage, where the psychedelics are becoming more clinical use, and also psychedelics are mostly isolated, so-called active principles of the entheogens. So the use is very different. But if one, from my perspective, from my experience, I have only 35 years of clinical experience with different natural entheogens. I cannot speak about the psychedelics, which are chemical substances. I've never used any chemical substance on my patient because I couldn't get hold of it, and also because I found the entheogenic approach a much more comprehensive. Because let's say you're a person coming from particular culture, and you're of a particular race, and your particular ethnicity, you have a particular education, your particular social status and class, and you have particular experience in life. And so that itself is going to be different in entirety than how it will be expressed clinically than some other person which is coming completely different background.
So let me jump in for a second, because I just want to clarify what you said, because you said an awful lot there. So I had this perception erroneously that like MDMA would be an entheogen, and maybe psilocybin would be a psychedelic. But what you're telling me is that these agents that are entheogens are maybe not just limited to MDMA, but the mushrooms, the psilocybin, the ayahuasca, all of these would fall into that category. And maybe synthetic psychedelics such as LSD would not be considered an entheogen. Is that an accurate way to sum it up?
Yes, it wouldn't be considered entheogen because it doesn't have the traditional background of it.
Okay. Now,
traditional background, I mean indigenous background. Because indigenous perspective is very different. I'm not saying that the clinical perspective is not valid. And I'm neither saying that the indigenous perspective is all to it. I think the integration of these both perspectives creates a third kind of possibility to go beyond these two and create more comprehensive, wholesome kind of approach. And that is what is ever so needed, because most of the people are focused on setting, no matter if it is clinical or in a ceremonial one. But very few people really understand that the skill is the third factor, which is extremely important. One needs to be trained, educated, formed in order to be able to navigate the non-ordinary states of consciousness. It is not just about a particular substance having a particular effect on a person. It is all about how does one interact, how does one relate, how does one connect with that substance. And that is where the skill is extremely important. And very few people ever talk about it, and very few people ever discuss this matter. Because when one consciously does something with the intention and pays a direct attention to what is happening, and is able and is trained and formed in such a way, educational wise, and as well as different modalities in order to better navigate the non-ordinary states of consciousness, the result is very different. It's not the same.
So let me ask you, when you're looking at a patient that comes to you and you've had all of these 3.5 decades of experience with entheogens, how do you decide what would be the best entheogen? Is it based solely on the history of present illness that patient presents with? How do you do that?
We would actually go in depth regarding the personal history.
Okay.
Then we'll go in depth regarding the medical history.
Okay.
Then we will do some medical tests if necessary. And then finally, we'll do psychological and psychiatric evaluation using different tests, as well as what is known as projective graphic tests as well. And then in this way, we will be able to define what is really happening with the person. And then we give a report to a person. And then the person, after reading that report, one would make a commentary on it. And then from it, we would start. And then in this whole process, we will decide if a person is eligible to use entheogens in one of additional tools in the healing process, in curing process. Because entheogens are not for everybody.
Mm-hmm.
Oh, that's there is a lots of fantasy going on out there, and people think that entheogens are some kind of what is the right term, the panacea, and that it's going to solve everything. No. This is not the case.
Right.
Because entheogens are just tools, and they are very fine tools, but one needs to learn how to use them adequately and properly. Because what I see now, unfortunately, more and more, so many people are taking entheogens or psychedelics without proper preparation, integration, guidance, and so on. And I have lots of people coming to see me. I just had a few Americans and then Canadian people, and then I had some from Europe. They get damaged because the whole process is not done properly. I asked them, okay, did you tell them your whole life history? No. Did you tell them medical history? No. Did you do some medical exam? No. Did you do psychological exams? No. Did you do some psychiatric exams? No. And you took this substance without doing all this procedure? I mean, it's a sheer madness.
Yes.
And it's not because it doesn't follow any science. It's just some kind of wishful thinking that I will take this and that is going to cure and fix me, like an instant fix. And there is no such a thing as an instant fix about anything. One needs to learn to interact and to relate and to connect and to relate with oneself in truth and integrity and honesty. in interaction with the physician or the therapist, there has to be this kind of understanding. Because if that understanding is not there, and one doesn't actively participate in the healing and curing process with the physician or the therapist, then I don't know what sort of results can you possibly expect.
Well, I think that goes to, I mean, you can say that about many treatments if they're not used in the proper context, and when it's truly medically indicated, you're cooking up a recipe for disaster, so to speak. So I think that there's a lot to be said about that. Now, if we took, let's say we took a patient with recalcitrant depression, and they came down to see you, you would do these evaluations, and then you would decide, all right, I think based on my workup, which sounds like it's very extensive, that we're going to use this particular entheogen. And can you explain a little bit about how you integrate this into more of a ceremony versus just you're at the treatment clinic and somebody comes in and starts an IV on you and says, I'll be back in an hour. You see what I'm asking you? Because
yes, I do understand. Well, as I speak various languages and I've been in contact with different cultures through my life, I spent 7 years on and off in Barrett, which is known as India, and English, which comes from Indus or the Sindhu River. That's the Greek term. There I have learned the yoga meditation, and also long time ago, and also the breathing exercises of pranayama. And then also I learned the sacred sexuality or tantra. And there I learned the martial arts, which is it's not really known in the Western world. It's Kalaripayattu, which is from southern India. And there I start understanding that that if you want to really create a change, you need to create the change in consciousness itself. You have to revolutionize one's consciousness. In order to revolutionize one's consciousness, you need to work on all the levels of one's being. You need to work on physical one. You need to work on an energetic one. You need to work on a mental, emotional one, and you need to work on the spiritual one. You need to work on all of them in order to bring a real radical change. So in a case of recalcitrant depression, the thing is that first to understand, as I said, the whole procedure I mentioned beforehand is what will be important to understand is that the depression in itself, it's not something which is written in stone.
right.
Meaning, it is not, if one doesn't have organic damage to the brain. If one has organic damage to the brain, is the one thing. But if one doesn't have organic damage to the brain, then the problem is only functional or physiological or metabolic or mental emotion or
Right.
spiritual. All of these things are only one. And so person being depressed is depressed. One looks for the cause of that depression.
Right.
One needs to look at the person itself. The person needs to be in the center, not just the diagnosis or the methods one is going to use. Is the person. One needs to understand the person, because the person itself is the depression.
So one of the things that they talk about in depression and in actually other mental conditions as well is the default mode network, and that the brain gets stuck in this circuitous, never-ending circuitry, and that the entheogens or psychedelics are believed to maybe change the default mode network. Can you talk about that a little bit, or am I just totally off base on that?
No, this is one of the neurological models.
Okay.
This is, we don't really, honestly, we don't really know what is really happening.
So,
I mean, in entirety, we don't know really what is happening.
Right.
But what really matters is the person itself. How does one interact with a person who is in a state of dis-ease, in this case of depression? How does one relate and interact with that person? It's extremely important. And how does that person interact and relate and connect with oneself? It is extremely important too. So in this interaction within and without is where the healing and the cure is possible. If one only looks at the biochemistry of the brain and the different models, the neurotransmitters and so on, and
Right.
one thinks that only in this way one can resolve one's depression, one is totally at fault, because that's only a part of the picture.
Right.
It is important part of the picture, but it's not everything. Let's say the lifestyle one is living, the quality of quantity and quality of sleep,
Mm-hmm.
the diet one is having, the exercises one is having or lack of them, and also in the mental, emotional, and the spiritual aspect of one's being. All those things are related to that depression, not
Right.
just biochemical model. And if you try to force and fix or fit everybody excuse me, into biochemical model, it's not going to work.
So I think
Because it's not going to work, because you are not taking into consideration other aspects of that person. You're just taking into consideration a biochemical or brain or neurological aspect. You're not taking other aspects of the person. And this is where the holistic, transpersonal, transcultural, entheogenic approach is much wider. And finally, what it does, it empowers the one of the state of disease or disharmony with the knowledge, with the tools about what? Not about depression, about oneself.
so. A similar analogy could be made the way a lot of chronic diseases are treated in the United States today. And that is, someone comes in with hypertension or diabetes and they say, okay, here's one tool. Here's a pill for you. Take metformin, or, and that's it. That it's like, but what you pointed out here is that, which I believe strongly, is that you have to have all of the components covered: spirituality, sleep, exercise, diet. All of these things are integral to the overall transformation, or whatever it is you're trying to do with that particular entheogenic agent. And that's not an easy process. It's not like American medicine, where it's one disease, one pill, or one disease, two pills.
Of course, it is.
Yeah.
It is a lofty endeavor.
Right.
It's a lofty endeavor, and it demands a lot of dedication and discipline and empathy and compassion and love towards oneself. Because when people get depressed, they all this rumination will start.
Mhm.
Endless one. I'm not good enough. What I think and feel and what I sense is all wrong. I'm not, nobody likes me, nobody cares about me. But actually, the crux of the matter is the relationship one has, the connection and the relationship one has with oneself and the world at large is reflected in depression.
So when someone seeks you out for therapy, you've just laid out kind of the roadmap of what you want to do for that particular individual. How do you go about formulating a treatment plan, getting them plugged into your system? What's the method that you use
Well,
for that?
the thing is, as I said, we go through all this procedure,
Right.
and then in down to earth, realistic, empathic, compassionate interaction with the patient, we decide with the patient what would be the most appropriate approach.
Right.
And so we would then use microdosing of the entheogens such as ayahuasca or Wachuma cactus San Pedro or the magic mushrooms, and start slowly, slow and low. And we start with a small dose, and then the patient would keep the journal and write his thoughts and emotions and observe, because the patient one needs to empower the patient with the tools, in this case, journaling, respiration, meditation, yoga postures, or whatever it is applicable. So the patient itself can look at oneself and go through this process of reevaluation,
So
reassessment of oneself, and not tinging it with negative and dark thoughts. And so if these negative or dark thoughts come out, then we also teach them what they need to do to change those thoughts. Because people who are depressed, they always have negative and dark thoughts. And I want to also mention then this state of the depression, because depression, as a matter of fact, is not just a disease, it's a syndrome. And more than that, it is a state of being of oneself. So in order to address the state of being, one needs to understand as well that intergenerational history and transgenerational history, they both also play a role in the state of the being called depression. Because if you have for generations people being depressed, that is passed on in one way or another to a present time. Trauma, it's a frozen present.
So
Trauma has no time. And so whatever happens in one's life, if one has been traumatized severely, one is always going to go back subconsciously, unconsciously to that trauma. And as I said, can be intergenerational or transgenerational. Not say that the trauma is the cause of all diseases and syndromes. That is not true.
can you explain what transgenerational transmission is? Because it's very interesting, and now there's some laboratory studies where they've done this in mice and affected one generation by manipulating things in the previous generation, and it's very fascinating. So can you explain that a little bit for the audience? Because I think think about that for a second. When you're born, you may have these things going on at no fault of your own, and then the course through life, whatever happens epigenetically, is likely to help or not help the manifestation of some of these things. So
definitely intergenerational is the thing which is related to the immediate family. Transgenerational goes way back. The best example of the transgeneration trauma would be indigenous people across the world who have been colonized and conquered by the white men or the Westerners. They have this transgenerational trauma.
okay.
Other example would be those people in the Western world which were not Christians, and the Christians came. And what the Christians did to indigenous people of Americas, let's say 600, 700 years ago, they did exactly the same to the indigenous people of the Western world, just 1,000 years before. And people don't understand still. They think that Christianity is native to the Western world. No. Christianity comes from the Middle East. It is not native to the Western civilization. It became the main drive within the Western civilization. But later in the Western civilization history, because the ancient culture of, let's say, Sumeria, Mesopotamia, Babylonia, Persia, the ancient culture of the Mycenae, or the Greece, or the one in Crete and later mainland Greece, or the other Illyrian culture along the Adriatic coast, the Thracian culture, they have nothing to do with Christianity whatsoever. Christianity is just a new thing for the last 2,000 years. So people don't think about it. How many people during the, Inquisition and the time where they're burning the witches were mostly women? How many people have been tortured? How many people have been killed? That itself can be that part of transgenerational trauma. And then, of course, the typical transgeneration trauma is the case of Jewish people, which is a terrible. One of my best friends here in Peru, two Jews, one from Toronto and one from New York, and it's incredible, is that transgeneration trauma they've been experiencing is still present in their lives, one way or another. And when you go into non-ordinary states of consciousness and you go beyond, and I have learned in India, the way how to work with that is by the means of using musical instruments, or in this case, a rattle, when will be more than 220 beats per minute. That will take one into non-ordinary states of consciousness automatically, and by chanting mantras, which are the sacred syllables in Sanskrit language, Vedic Aryan civilization, which has nothing to do with the corruption of the Aryans and the Hitler and all these crazy things. It's not a racial denomination. It's the state of consciousness. It's the state of beingness, which meaning the noble or the lofty ones, the one who follow the path of the non-ordinary states of consciousness. Because the soma, the elixir of mortality, the original entheogen, is related to that civilization and is related to the yoga and to meditation, and related to the amazing breathing exercises and the martial arts and sacred sexuality and so on, because they understood one incredible thing, is that we are the cosmic beings and we need to learn how to navigate life and be in a harmony with the nature and the cosmic forces. They masterminded the whole procedure, and when one works on it, one realizes that is the case. So when I was working with some of Jewish people, in their non-ordinary states of consciousness, they were their ancestors who are coming to the ceremony. We all saw them. This is not a kind of psychosis or hallucination, because there is a difference between hallucination, the pseudo hallucination, and non-ordinary states of consciousness. These are not the same things. They might be similar, but they're not the same. So the non-ordinary states of consciousness, there are these ancestors of Jewish people. They are talking to them, and then talking to me, and then later, it was the whole understanding was incredible because that's what is really happening. Unfortunately, very few people are really understanding that, and very few people are scientifically working, trying to find the technology which can measure those things. The problem is with all these things is that we don't have sufficiently enough technology which can explain the for instance, the consciousness itself. There are so many different models, but none of them is satisfactory. None of them can explain to you exactly how the consciousness happens and what is the cause of it.
Mm-hmm.
Nobody
Right.
can do that.
Right.
But only when you go in the non-ordinary states of consciousness, you can come closer to it. So the idea is that you need to be trained to be able to stay in that non-ordinary states of consciousness, being grounded and centered. And then in non-ordinary states of consciousness, you can receive the information and understanding, and then you can bring that information, understanding, to the conscious state, to the mundane state, where then you can apply that understanding in order to better the one's existence and the world at large. This is the thing. So there was this incredible work of Dr. Strassman, who did this work with DMT, injectable DMT, and all that. But still, there is much more to be done, because the whole thing is about conquering fear of death.
Mm-hmm.
That's the whole thing. The essence of the crux of the matter. How do we conquer the fear of death? And how do we accept the fact that one day we are going to die, but that is not preventing us from living fully?
Right.
And not looking at death and something negative or horrible, but something which is just a part of life and something which has to be celebrated, as a matter of fact.
Right. So
they just celebration. So celebration of life and celebration of death. So we can go beyond, because we don't really know. Nobody can tell for sure what is happening the moment we die in this physical form. Nobody can tell.
Right. Now, when you use these entheogens to get to an altered state of consciousness,
non-ordinary state.
Non-ordinary.
Altered has a negative connotation.
Okay, I misspoke. I apologize for that. But what I'm saying is that you use this entheogenic agent, and it basically allows the brain to connect with a dimension that it's not ordinarily able to connect with. Is that
exactly?
Okay,
exactly.
That's a fair way to put it, right? So I think what you're saying is that certainly in Western civilization, in our culture, we don't deal with death very well, and we've never been trained in it. Other cultures, I think, are much better in their acceptance and integration of death into the whole process of life, and that there is more of a cosmic, supernatural construct that we're part of, rather than what we perceive maybe as just, here's our time on Earth and that's it. So are there different, do you have, you just said that almost everybody deals with this, but are there cultures that deal with it so much better in your experience, or not?
Definitely. The cultures, the ancient cultures of the ones I mentioned earlier, all the ancient cultures, they've been using entheogens, and they learned how to deal with it better. When the Christianity came into the picture, when the Buddhism came into the picture, when the Hinduism came into the picture, Jainism, when the Islam came into the picture, all these things started to change.
Okay.
And so the death was taken as something negative, horrible, and not a part of life, not something which one needs to learn how to transcend in order to live fully.
Right.
And there is no understanding. Other cultures like Bardo, it's a particular way of understanding within the Tibetan Buddhism, what happens when one dies and so on. In a Christian culture, these things are actually non-existent. And so the whole idea that one is being born with the original sin. I mean, how can one be born within the original sin?
Before we continue with this great discussion, I just want to take a quick break to acknowledge this week's sponsor. I'm constantly exploring new avenues to enhance well-being and address any health concerns. Today, I'm thrilled to introduce you to an exciting supplement called Stem Regen, which I take daily and genuinely believe could revolutionize your health journey as well. Stem Regen stands out as a game changer in the realm of wellness. Crafted from 5 potent plant extracts, it boasts a remarkable ability to stimulate the release of your body's own stem cells from your red bone marrow. Why is this significant? Well, stem cells are the superheroes of our body's natural repair system. They possess the extraordinary capacity to morph into various cell types, aiding in tissue regeneration and repair. As we age, the quantity of circulating stem cells in our system reduces significantly, impairing our body's ability to heal and rejuvenate itself effectively. Stem Regen steps in to counter this decline by kickstarting the release of stem cells into circulation, thereby bolstering your body's innate repair mechanisms. Once unleashed into your bloodstream, these mobilized stem cells actively seek out areas of damage or injury, initiating the healing process. By incorporating Stem Regen into your daily routine, you're essentially empowering your body to tap into its own regenerative prowess more efficiently. I firmly believe that Stem Regen could be a valuable addition to your wellness regimen, especially if you're seeking to fortify overall health and vitality, accelerate tissue repair, or expedite recovery from injury or illness. This first of its kind stem cell mobilizer is changing the game in regenerative medicine. Don't wait to unleash your body's innate healing capabilities. Visit stemregen.co/Dr. Steven, that's with a PH, and use the code SBPOD to get a 15% discount off your first order of Stem Regen. Well, maybe that's the transgenerational DNA methylation change that you're bestowed with. I mean,
Exactly, yeah, because it's been bestowed upon you by the way the people have been treated.
Right.
If you treat somebody with kindness and understanding and empathy and compassion, that is definitely going to be beneficial to a person and yourself. But if you treat somebody in hatred, animosity, negativity, or violence, that is definitely going to affect the person and affect you, because people don't realize whatever you do and whatever you don't do as well affects you and everybody and everything and all around you, because you don't live alone.
Right.
I mean, when we go further, then we know that we have an enteric nervous system called as a second brain, and we have 7 trillion at least, or different kinds of microbes, protozoa, viruses, bacteria we co-inhibit with. We do not live alone.
Right. In fact, we couldn't.
Our DNA is very little ours, as it were. It's more the DNA of these microbes. So that's why it is important to work with the microbiome. And that's what the problem is when people go in entheogenic therapy. Then if the microbiome is not harmonized, how are they going to be able to absorb the entheogenic substances properly? How it's not going to work. So that's why we also do the DNA test of the microbiome, and we try with the probiotics, prebiotics, and postbiotics to regulate microbiome as optimally as we possibly can, and then the whole thing is very different because, as you know, 90% the neurotransmitters and other things are formed in the gut.
Right.
So
Exactly.
so even the medication you take, whatever medication you take, chemical medication, if your microbiome is not in order, how much of your assimilation of that medication is going to be? What's going to happen with your liver?
Well, exactly.
This,
Right.
and that. So I think it should be in every single medical doctor should do the microbiome evaluation. Of course, we are at the beginning of understanding of it, but what we do understand, we should apply clinically. And we should apply consciously, because what's the use of somebody who is having a primary hypertension or high blood pressure, which is not essential hypertension, and that somebody is not regulating his or her diet? What's the use of it? It's just absurd. Or it's not doing any exercises, and it doesn't work that way. And medicating, with that idea that medication is the only way forward and is the only way how things will be sorted out, from my perspective, I'm sorry to say, is a total lunacy.
Right. Well,
and
I think
I lived through childhood. My father was an internist and cardiologist. My grandfather was STD specialist, and others before them. And so, I lived with two doctors in the family, and they were just, I was going with them. I have my 104 years old doctor's bed of my grandfather, which I'm carrying wherever I go. And I understood. My grandfather used to say, was STD specialist and bacteriologist, virologist. At that time, there were no infectious disease specialists. He used to say to me, listen, laddie, he said, viruses and bacteria are just passengers. They come and go. Mm-hmm. What is the most important thing is the host.
Right.
Is the host. You need to look at the host. Don't only focus on bacterial virus. You need to look at the host, because if you are not looking at the host and you're only dealing with virus and bacteria, you're gonna not just have a limited results. You're also going to have a limited understanding,
right?
And you are going to cause also damage because of this ignorance, because this arrogance of thinking that I know lots of things, but I still know that I don't know everything,
right?
And I'm doing my best to learn, So I'm going to India because these people are using different methods. And I will stay there, observe, investigate, and figure it out if any of those methods, because what they do, which I also do, but what they have perfected the different diagnostic methods.
Okay.
They do the tongue diagnosis, they do the pulse diagnosis, and they do the urine diagnosis. And for conventional medical doctors who have no understanding about this thing, they can all think, that's a pseudoscience, hocus pocus, what a lot of nonsense. But actually, when you go deeper into it and you integrate this with the conventional knowledge, I'm talking about integration. This is my point.
Mm-hmm.
Then you understand that particular therapeutic methods are valid. And they tell a lot about what the conventional orthodox medicine, psychology, with all the technology has, cannot even come close to it. It's incredible.
One of the things that I wanted to ask you, because you have experience in living in the Amazon, one of the things that I heard,
18 years.
One of the things that I heard regarding ayahuasca is that the indigenous people that first developed this had to be very sophisticated because of the construct had to be so that this material was present in order to affect the bioavailability of this other agent, and that it's a very sophisticated thing. It's not like they just, I guess what I want to say is that these people had to have incredible knowledge and insight to come up with this type of a ceremony. So talk about ayahuasca just a little bit for the.
Well, the ayahuasca is a Quechua term because that's a new name that possibly came during the rubber gum kind of business which was taking place in the Amazon here. It's because it's a Quechua word, but the Quechua is the language which Incas used to speak. They learned that language from other indigenous groups here, which are not from Amazon. They are from Andes region.
Okay.
So Aya means, it can be interpreted as a soul or spirit or ancestor. And Huasca is the vine or the creeper. So that's the vine of the soul or vine of the spirit or vine of the ancestor. This is the name of the beverage, but it's also the name for the vine itself, which is Banius stereopsis species. According to indigenous people, they have a different kind of classification for the ayahuasca. They call it yellow ayahuasca, red ayahuasca, white ayahuasca, black ayahuasca, serpent ayahuasca, rainbow ayahuasca. They have different names, but there are more than dozen species and subspecies of the Banis stereopsis capi. And that is where the major antidepressants are, which are the MAOI inhibitors too, which are the alkaloids, which have the antidepressant activity. And when you divide them, because the problem is now, the study has always been done for various reasons, only to a certain active principle being isolated. It has never been done really in detail about the extract itself when the plant contains all its so-called active principles and has the entourage effect. But it has antidepressant activity, is emetic, induces the vomiting, but not the vomiting is when you are sick. Well, sick in the sense that you have eaten something and you got poisoned, so you need the gastric lavage to clear you out. Not that kind of vomiting. Is the vomiting which is emetic because it cleanses gastrointestinal system. It also cleanses also mental, emotional states, or the conflicts, or the spiritual problems, or whatever. And also it helps in cases of Parkinson. And then that itself, it's one liana, a creeper, a vine, in the jungle. And there are thousands and thousands of, plants there, and hundreds of, thousands of lianas. How did they pick up this liana? That's a huge question.
Right.
Then,
right.
At the same time, that is just one part of the picture. Another part of the picture is that coffee family plant, which is the major one is chacruna or psychotria species. There are many different ones. This is which has DMT in it. So the indigenous people say the force and is in the vine, because the vine, it's like creeps all the way up and it's at the very canopy and it's absorbing the sunlight, and the vine, it's intelligent. It's an intelligent being. That's what people don't realize. We humans are supposed to be intelligent beings,
Right.
But also the plants and the animals are intelligent too in their own sense of the word, in their own beingness. They're also intelligent. So that vine, it goes together with a particular tree, not just any tree. and then uses the tree to climb all the way at the top. So they say this is the fourth. And the other one, which is DMT, called the spirit molecule, which is a very interesting chemically, interesting molecule.
That's also referred to as the God molecule, right?
Yeah, or God, the spirit molecule. And that is in those leaves. And they say that is the light, because where the light comes from. And the indigenous people, they collect this thing at a particular time in the morning, and you can see that it's incredible, because when you see it, when you go into it deeper, you can see that there is this kind of a light over those leaves, and so they combine these two things, and then they created this beverage where they use it for different reasons. They use it when they wanted to find out what is going to happen, or they find out about the disease about somebody, or they find out about the other tribe, or whatever. We start using it in a different way. They never use it in the healing practices. They never had a concept of depression or anxiety or any kind or personality disorder. They have their own understanding. But it's absolutely incredible, really, when you think about it. Let's say, most conservatively, there are at least 75,000 different plants in the Amazon. And how would somebody find one plant another and put it together? I mean, it just, how did they do that? You can then think logically, okay, try and error. Try and error? How many years would that take? Million years?
No, yeah. No, that's why.
It's not possible. So they must have worked with other things, with entheogens, and possibly when they work with these other entheogens, because there are many other entheogens in the jungle, like I mentioned before, Wilca, or the other Yopo, which is another species of plant, which also has DMT, but has a 5-MeO DMT and has a buffeting in it, the same one which is in the toad painter.
Right.
So, they might have used other entheogens, which brought them to that understanding, because it has to come from understanding. It cannot just come by try and error. Or it is possible also when they went into the non-ordinary states of consciousness, they received information from there.
Yeah.
From the non-ordinary state.
Right.
They received information from there. From whom or what? Well, that's difficult to say. But they received that information, and they brought it back, and they start using it. Indigenous people are empirical people. They are practical. They've been using these things. And so, for a long time. And so, unfortunately, because of the way everybody, one way or another, has been colonized on this planet, nobody can say that's not the case. So, but the way how the colonizers dealt with indigenous people in Americas, it was a sheer genocide.
Oh yeah. Yeah.
And they did not understand that these people have a lot to teach us.
Right.
And we need to integrate with them and learn from them in order to progress, because the way the things are now, I mean, it's just, what kind of progression we are talking about?
Right.
It's not really happening.
Right.
I mean, how is it possible if you think it further down? Let's say I do not just believe, I know there must be other forms of life in this infinite universe. There has to be. It is not impossible that it's impossible that we're the only beings in this universe. It just that doesn't make any sense. And so think about if these other beings in the universe, who are much more advanced than us, most of them, how do they look upon us? They see us. What are we doing?
Right.
We are destroying ourselves. We
Right.
are poisoning the air. We are poisoning the earth. We are destroying all these unnecessary wars,
Right.
warmongering, vented interest, It's just totally crazy. We're living, actually, from my perspective as a psychiatrist, we are living in psychosis without even understanding, because nowadays,
Right.
most of the things are becoming accepted.
Yeah.
They're just okay, no problem. It's
Right.
a man beats up a woman, or somebody, a woman kills a child or whatever. No, that's like not a big deal, really. It's just that we are finding ourselves in the biggest crisis in a human civilization ever.
Right. No,
We're
there's
finding ourselves in it, and we think that there is somebody out there going to come and save us. That illusion. It is ourselves. We need to save ourselves, and it's ourselves we are waiting for. Ourselves. We need to change the way we think, we feel, and the emotions we have. We need to change the way we connect and relate to ourselves and others. Racism and discrimination is just, it's present more than ever. Like I went to Europe and Central Europe, and then the local people said to me, "Oh, we dislike and hate everybody who doesn't speak our language." And I said, what kind of attitude is that?
no. Yeah.
It's where is the empathy? Where is the compassion?
Where's
Where is the understanding that we are all the same boat? And where we're gonna go, it depends not just on ourselves, but everything at all. We need to find a way to live in harmony with oneself and everything at all. Because if we do not change that, we are deeply treading the road of self-destruction.
Oh, I can't agree with you more. I mean, it's a very sad state. It's almost like there's no common sense anymore. And, so I guess I got to wrap up this wonderful conversation, but if you had one piece of advice for folks that are looking for maybe some type of integration with one of the entheogens, what would you do? What would you recommend that they do to make sure that they get the proper comprehensive treatment like you laid out? Just your thoughts on that.
Well, first, they should get educated.
Okay.
They have to educate themselves. That's extremely important. And they need to understand it is not just the substance they are taking that matters. It is themselves, how they connect and relate to the substance, interact. So they have to develop a skill in order to interact with these substances. Indigenous people think and feel and believe that these entheogens do have spirits. Now, we can discuss that indefinitely and will never come to any thorough conclusion. But it's very important that one takes one state of being in all its ramifications as a journey, as a lofty endeavor, one needs to stay curious, and one needs to be like a child. You remember when we are children and we are in that state of awe and wonder, and everything looked incredible, everything was interesting. We need to go back to that state
Right.
to go back to the state and play with this inner child and learn and understand that life is a process of learning. It's not like, it's not it's not a prison. There are many people who are telling me, oh, Doc, the life is a prison. I said, no, wait a second. Life is a good side and has a bad side, but all of it is experience. The only thing that matters, what do you make out of it?
Right.
So learn, educate yourself, surround yourself with the people who really know what they're talking about, and learn and grow and evolve. Work on yourself, and connect to others, and that is going to bring you to a better understanding and a better relationship and connection with oneself and everything involved. Don't think that whatever is happening, it's meant to be. And don't think that whatever is happening, it's a destiny. Because lots of people think like that, oh, well, it is this and that. And I believe that there's always a possibility, opportunity to grow and evolve. But one needs to honestly and with integrity pursue that path, because life is all about experience. It's an experience which we need to grow from, we need to evolve from, we need to learn from, and we need to share that experience with others who are also on the same path. And then together we need to work hard in order to make our life and everybody's lives and everything and all a better place. Because the world, the way how it is, people talk all the time about discrimination and racism, which the white people, the Western people have done to others. But wait a second. The white people and Western people are also discriminated. There was a racism towards them. And still is happening too. If you travel in areas where there are no white people, you will experience it.
Right.
So you need to understand that race is a social construct.
Right.
It's not a scientific construct. And we need to learn how to live in harmony with each other, no matter what race, ethnicity, no matter what education we have, no matter what cultural background we have, no matter what religion or spirituality we follow, but we need to learn to be in harmony.
Right.
Because if we don't learn, and the harmony starts first with oneself, how can you possibly have a harmony with others if you don't have a harmony within?
No, you can't. You can't.
So life is a journey. Educate yourself, work on it, and things will change for the better. But if you stay there and wait for somebody to say and think that there is a destiny over, nothing ever is going to happen.
Right.
Because I've seen amazing things, I've seen amazing things that people are capable to do, when they really understand that they have to really do what is best for themselves and others. So when somebody does something, one needs to ask oneself, what I'm going to do or not do, is this going to benefit me? Is this going to benefit everything at all? If that, am I going to cause suffering and pain to myself and others by doing or not doing, by thinking or not thinking, by feeling or not feeling a particular thing? Then I better choose the one which is going to benefit me and everything at all. That is what my message is.
Doc, so much thanks for you coming on. I can't say that I've had anybody that has had such a vast cultural experience, and it's an honor for me to have you come on the show and share your wisdom. So thank you very much.
Thank you. Have a beautiful afternoon.
You too.
Bye for now.
Bye-bye. That was great.
Oh, shit. Oh, shit. No.
No, you're all right.
No, I'm here.
Yeah.
Yeah. Tell me.
No. Yeah, no, that was great. Everything recorded really well. I don't know if I asked you good enough questions, but
maybe next time next time, please, particular thing with maybe this methylation thing,
Yeah.
I can explain because I've I'm a cancer patients, and then work with them and use the entheogens and change the thing.
Are you doing any work with chronic pain patients?
Yes, I'm doing that as well.
Because my specialty is peripheral neuropathy.
I know what you do.
And we have people that we just can't get better. And I'm thinking that this might be something else that we could at least look at from a treatment plan standpoint to
Definitely.
see, and one of the things that I wanted to do is to see if I could develop an affiliation with somebody who has this experience that we could put these patients, at least get them connected to somebody like you or some other center where they can get, because I've seen some reports now where patients with very severe complex regional pain syndrome, they've had some entheogens and it doesn't make their pain go away, but it makes them be able to deal with it so much better. And that's the key. So yeah, I'd love to.
We are trying to set up a hospital and inpatient, outpatient facilities, educational center, educational academy, and the research institution with lab on the land. But we need the funds.
Right. That's
the donations. We need donations to set this up on the land. We have 7 acres of land in the upper Amazon next to the river. And that would be, once that project is being set up, then it would be possible to get these patients over and yourself and then do the treatment and do research on it at the same time.
Right.
And write then the papers about it, because that's what is necessary. But we need an environment. We will never gonna be able to do this in the States or Britain or anywhere.
Right.
Here in Peru. That's why I came here, because I had to pass all my exams in medicine and psychiatry in Latin American Spanish or Castellano. It took me 4 years to do it, but I did.
Wow.
But it's so what I'm saying is that we need to have a place where we can do this. And this is the ideal place, because I have all the licenses and everything. So the only thing, we need the dosh, we need the cash in order to set this up. And when it's set up, the doctors from abroad can come also and be trained. This is this is going to bring a huge change. So the only thing now, it's missing the money for it.
Right.
And I'm not a businessman. I'm a clinician.
Right.
I'm a druid. And also I'm recognized as a rishi or sage in India. So, I'm a clinician. I am not a marketing guy. I am not doing any propaganda or anything. But I think this is an opportunity we have. And also, if we have a lab, then maybe we can make injectable forms of these entheogens intravenously and intramuscular that definitely can help. There are many possibilities here, but we need the funds.
Right. No, I understand. I'm a clinician as well. And even though I have an MBA degree, and I just consider myself a bad business guy because I'm not interested in that. I'm interested in getting patients better and learning, and that's where my focus is. So
yes.
But yeah, so yeah, no, I would love to get you back, and let's just talk about maybe the effect of entheogens on DNA methylation, just very specific on the physiology.
Send me the note, and I can talk about it.
Okay, sounds good. And I really loved what you had to say. I love what you write and put on LinkedIn. And I think, you have such a different perspective on things that we need to hear more of that, quite frankly. And so
Thank you. Yeah, I
so
hope so. The other medical doctors will understand that being a doctor comes from a Latin word,
docere,
docere, which
right,
means teach,
right, right,
to teach others in order to learn how to live in harmony with themselves and the rest, And the doctor nowadays is not any teacher anymore or doctor of any specialty. He doesn't know how to even help himself or herself.
right,
It's,
right.
I had just a friend recently who died, uh, severe brain tumor, but it's because even he was very famous psychoanalyst and all that. It didn't help him. And I told you, what are you doing? I mean, once they diagnose you something, you immediately run over to Houston and do the radiotherapy, chemotherapy. I mean, come on. You need
Right.
to, you need to sit down. You need to breathe. You need to take a rest. You need to think. You need to understand that what is happening to you, it is of your own making. You need to take responsibility. He never did anything, and he died horribly.
Oh,
It was
yeah.
terrible because that's unfortunately like many years ago when I was a young physician. I had classes in dermatology, and we had the classes about alopecia areata, and there was this dermatologist who was bald.
Yeah.
I said, how is the bald dermatologist going to teach me about alopecia areata when he couldn't even cure himself?
Right. Right. It's kind of like the smoking pulmonologist.
Yeah.
Yeah.
Yes.
So, well, thanks.
That's
I appreciate you so much. I got to jump off, but I'll be back in touch and I'll let you
okay.
know. And if you can send me a good headshot, high resolution for the show notes, that would be
Okay.
great. And
Just send me a note. Send me a
okay,
note so I remember.
you got it.
Send
All
me a
right.
note on which topic you would like we discuss, and I definitely will send you a little article about it, and then we talk about it.
Sounds fantastic. You have a great rest of your day.
Thank you. You
All
too.
right.
Bye
Bye-bye.
for now.
Bye-bye. And now a message from our sponsor. Well, folks, if you're over 40 and you're not using a supplement to augment nitric oxide production, you should really rethink that. This molecule is absolutely imperative to health, not to mention the cardioprotection. Nitric oxide is a physiological molecule that does so many things for your health. I never miss a day of nitric oxide supplementation. That's how important it is. Long overdue, there is now a nitric oxide replenishment formula without the fear of oxalates. Approved Medical Solutions does not use beets, spinach, or arginine. Approved Medical Solutions is proud to offer our audience their oxalate-free nitric oxide formula. If you are not a healthcare provider, you can still get started by going to approvedmedicalsolutions.com and use the code SBarrett at checkout, and you will receive a 10% medical discount savings. For licensed practitioners, just go to approvedmedicalsolutions.com and register. They have unique bundles for all of the full-fledged spelunkers of the Pod of Inquiry. Use Pod of Inquiry at checkout after registration, and I am certain you will be pleased not only for yourself, but for all of your patients. Here's a little secret. If you order their testing strips and test every patient for a few clinic days, you will see that nearly every one of them will be deficient. When they see this result, they will want you to start them on it immediately. Now, thanks to Approved Medical Solutions, you can give them the best care without the worry of oxalates. Thanks for watching. You can start today. I hope you all enjoyed today's show and got some truly empowering knowledge out of it. You can always follow up on anything we talked about in the show notes found at our website, podofinquiry.com. If you think you might have tickled just a few neurons inside that cerebral cortex, please spread the word to your friends and colleagues and tell them that they need to get spelunking. Also, if you can take a minute to leave a review on your podcast provider of choice, and especially Apple Podcasts, that would greatly help the show and be so appreciated, provided it's positive. And if not, then just keep your pie hole shut and stay down in that cave. Let's keep spelunking.
This podcast is designed for informational purposes only and does not constitute any medical or surgical consulting advice or imply a development of any physician-patient relationship. The opinions of guests who are featured on the show are not necessarily the opinions of Dr. Barrett or the production team. This podcast is owned solely by Barrett Medical and Surgical Media, LLC. While the show is highly oriented for physicians and healthcare providers, anyone interested in the improvement of human performance and understanding will find this a welcome goblet to sip from, or guzzle. However, no representation or warranties are made in any way whatsoever on this podcast for any products, techniques, or other things discussed. Invited guests are not vetted by the Pod of Inquiry for their qualifications and may have a direct or indirect financial interest in what they present and discuss on the show. The Pod of Inquiry disclaims any responsibility from anything taken from the show and used personally or professionally. It is a responsibility of the listener to perform their own due diligence prior to the implementation of any ideas, products, techniques, or anything talked about on the show.